Greetings, everyone. Thank you for joining us here at the 1947 Partition Archive. Given the critical situation South Asia is facing right now with the COVID-19 crisis, we're adding some new programming to our channel to answer your questions about the crisis. Today's topic will be diet during and post-COVID. My name is Vanshika Sharan, and I'm volunteering to bring you this episode. Joining me is Ms. Samadar. With extensive experience in the field of nutrition and dietetics spanning more than 26 years, Ritika Samadar is a registered dietitian, is presently the regional head of dietetics, Max Healthcare Delhi. She is also a certified sports nutritionist, a trained bariatric nutritionist, and a certified diabetes educator. She's presently the Joint Secretary of the Delhi chapter of Indian Dietetics Association and the regional officer of the Delhi chapter of IAP. Thank you so much for joining us today, Ms. Samadar.
Good morning, all.
Yeah. So jumping straight forward into our questions. Firstly, what should we keep in mind for our diet while we have COVID and during post-COVID recovery?
Okay, so I'll actually answer them in two sections. So one is, of course, when somebody is suffering from COVID, which is actually the acute phase, and then, of course, the post-recovery, right? Now, when we are talking about people who have suffered from or have COVID, so there are two people, a section of population. One is, of course, the asymptomatic, which is quarantined at home and all. Then, of course, because the symptoms are not very, very severe, probably we're just concentrating and, of course, telling them to have plenty of water or hydration, which is the key for recovery from any of the viral disease. And as we know, COVID-19 is also a viral infection. Hence, hydrating yourself well. And when I say hydrating, do not restrict yourself just to plain water, but the different kind of liquids. So whether it's your juices, whether it's your, buttermilks, etc., any kind of hydration is very good. Also, while you're asymptomatic, make sure that you're eating well, home-cooked food, preferably not very, very high on fats, but make sure that you're concentrating a lot on the proteins. So just eating a healthy, balanced, home-cooked food is what is actually required while you're home quarantine and are asymptomatic with COVID-19. But people, of course, who are getting admitted and all, getting into a little severe kind of infection, the diet is, of course, completely different. And as we get to see in our hospitals, of course, the basic, purpose that time is, of course, getting them out of the COVID symptoms and getting them into the negative COVID symptoms. But of course, that time, again, we make sure that they're getting high proteins, giving them small, frequent meals. Loss of taste is a very, very common symptom. So therefore, you really have to look into their taste buds and make sure that whatever little they like, and not restricting much of the calories and the proteins and the fats, whatever the patient feels like eating, plenty of hydration is the primary goal. Now, this is, of course, while they're suffering from COVID. But now we have, of course, now that we are almost out of it, and hopefully we are not going to get back into this severe condition, which India was a few weeks back. But definitely, we are getting a lot of people in the post-COVID recovery phase. And that phase is very, very important, especially when we talk about nutrition. So there are 2-3 basic things which we really need to look into. One, the recovery takes at least 4 to 6 weeks for sure. So you really have to look after yourself for the next 4 to 6 weeks post you've come negative and come back home. So one, make sure that your plenty of hydration keeps on going because you've been on a lot of medicines, a lot of steroids. So you really need to detoxify your system. So a lot of hydration is very important. The second, what we've got to see is that there is a severe muscle wasting in most of the people, specifically the ones who got admitted in the hospital. So again, a high protein diet is very, very important. And when I say a high protein diet, make sure whether you want to take your non-veg foods, your eggs, your dals, your nuts and seeds are an excellent source of protein. And you need to continue with this diet for, again, at least for 4 to 6 weeks. The third important problem, what we are facing a lot is, of course, a lot of people coming back getting readmitted with COVID complications. And that's because of the massive use of steroids or because of uncontrolled sugar which they had during the phase of COVID infection. And we know that there are certain kinds of, whether it's a fungal infection or even the other kind of complications which are related to high sugar. So we have to be very, very particular. And in fact, I would say very strict restrictions in terms of diabetes control post-COVID recovery. So whenever we do a lot of home counseling and we are, talking to our patients on the phone, and we make sure that there is a strict dietary restrictions in terms of a good sugar control. And of course, any kind of complications, underlying comorbidity with the patient has, whether it's blood pressure, whether it's dyslipidemia, whether it's diabetes, this is the time post-recovery. You have to be very, very careful to keep a strict dietary restrictions so that the complications do not come back. And of course, over a period of time, get into a little bit of active lifestyle in terms of exercise, because remember, when you walk a little, you exercise a little, you tend to put back your muscles much faster. But again, that has to be done with caution, because too much of exercise post-COVID is not considered to be very, very healthy. So it's a gradual transformation, but again, a line of caution for everybody that even once we become COVID negative and we are back home, getting back into a normal lifestyle, the diet is very, very important for at least the next 4 to 6 months, for 4 to 6 weeks for a complete recovery and getting back into your healthy lifestyle again.
Yeah. I think you've touched on something really important here about just people being more proactive about taking care of their health, right? Considering that periods of lockdown often involve people sitting at one place for long periods of time and not having a lot of physical exercise, how can somebody maintain their health and immunity during periods of lockdown through their diet and through exercise?
So, we've just realized, I think, during this last entire year, how important is to have a good immunity, right? So it's not that there are certain foods which will actually prevent you from getting the infection, but definitely people who have a good immunity are probably be able to fight the disease better. And in case if somebody gets the disease also, it will be probably a very, very mild or an asymptomatic form. There will be no kinds of mortality for sure. So immunity is the key word. Now, when I talk about immunity, we really need to understand that immunity, yes, of course, diet plays very, very important role. And I would say 50% of your immunity is from what you are eating. But besides that, as you just mentioned, the exercise or your active lifestyle is another very, very important factor when you look into your immunity. So, what how you're leading your lifestyle, whether there's certain things like smoking, drinking, your sleep pattern, how stressed you are, these are all factors which actually reduce your immunity. So initially when the lockdown started last year, around the same time, we were obviously, because all of us coming together at home. So, there was a lot of these family involvements and, they used to exercise. So in fact, in the first 5-6 months, I used to get a lot of positive feedbacks from my, family members, from my friends, from my patients, that, they've actually started exercising together, eating healthy food, cooking food at home. So yes, the first 6 months were really good. And we used to get, a lot of positive vibes from our patients and of course, my friends and families. But now, of course, I think probably because it's got extended too much that, people have actually gone back to a very, very, I would say, a negative lifestyle, which is like not exercising, started ordering a lot of food from outside, so started eating a lot of junks and processed foods, etc. And we've seen in the last, couple of months, 6-7 months, people have again started putting on a lot of weight. People with comorbidities, like as I just mentioned, sugars, hypertension, have again started to increase. So as I said, these are very, very important factors. And even though we are restricted in our house, we really have to look into the ways where probably leading a good, active, healthy lifestyle, which is not just eating healthy, but also reducing your stress, doing some kind of exercise, having a good sleep, which is very, very important, are equally critical when we're looking at improving our immunity as a whole.
I think, additionally, there has been a lot of information on the internet that people have been with reference to how to take care of their diet. But just there have also been claims online stating that the virus can be transmitted through food, and that certain foods are either to be avoided during COVID-19 because they might increase the chance of getting infection. Is there any truth to these claims? Or are there any foods that we should be avoiding?
Yeah, this is a very, very important question. And I think through this medium, I would really like to put across that, you get regular updates on this on WHO website. And if in our own country, we have FSSAI and NIN, which are working a lot on this. So till date, we've not had any kind of direct transmission from the foods to humans in this particular infection, COVID-19. So definitely, it's completely safe to have a lot of your fruits fruits and vegetables. And again, to emphasize that when we talk about immunity, the most important are your multivitamin, your vitamins and your minerals. And when I say vitamins, it's basically your A, C, D, and E. And remember, when we talk about vitamin A and vitamin C, that's nothing but just coming from your fruits and vegetables. So it's very, very important that you have to take a lot of fruits and vegetables. But when we talk about the hygiene and the sanitation aspects, that's equally important. And I think in a way it's good, because now we realize that it is very, very important to, keep whatever you're eating, whether you're getting things from outside, to absolutely make it very, very hygienic before you consume them. So simple measures, which again, these are things which have been guided to us by the FSSAI, which is a guiding guidelines regarding your foods and the safety of foods, which states that even just washing your fruits and vegetables under running water for 2 to 3 minutes is a completely safe method before you can consume them. Even if you're getting packed things, etc., from outside, just make sure that you clean it up properly. But yes, very, very important is, if you're holding on something which is coming from outside, please make sure that you sanitize your hands before and after handling any kind of food or a packaged or even a ready-to-eat food which is coming from outside. So if you follow these basic guidelines, there is no way that the infection can be transmitted from, the things coming from outside into humans for sure.
Yeah. Thank you so much for giving us specific questions. I had one more question specifically about where people should be going if they're looking for proper verified information during the pandemic on their diet. Should we be consulting professionals, or are there some specific resources online that we?
Yeah. So again, very, very important, as I said, and I sadly but truly, this infection is going to be there for some time, right? And we really have to look after ourselves. In fact, this is the time which has given us, important lessons to be learned, that how important is eating healthy, how important it is to build up your immunity, how important it is to live an active lifestyle, how important it is to control your comorbidities. And if I, pin down all these important points, the most important thing is you really need to consult somebody who can actually give you a scientific based information. So yes, there are sites where you can get these information. So for probably speaking from India, I can talk about, so we have FSSAI, which is our guiding force, which tells us all the norms and regulations with regards to food safety and hygienic practices. We have the Indian Dietetic Association, which is of course our which gives us the guidelines, and it has even given us guidelines for post-COVID recoveries, etc. But besides that, I think very, very important that you must consult a dietitian, a registered dietitians who are working in hospitals, or even for that matter have their own clinic, to get the right information. Because yes, during this last couple of months, we got to see a lot of these messages and the WhatsApp messages and all. And let me tell you that those of course have gotten a lot of wrong informations across to the community and are doing much more harm than any good. So it's important that you take verified information and visit a registered dietitian who can probably give you the right information.
Thank you so much for joining us today and enlightening us, Ms. Samadar. We will be hosting episodes on numerous topics related to COVID several times a week at 9 a.m. India time. Follow us on Facebook or subscribe on YouTube to catch all these. Thank you for